Sharon Begley, Can't Just Stop, An Investigation of Compulsions. Delve into the complex world of compulsions with a Can't Just Stop, An Investigation of Compulsions by Sharon Begley. This book examines the increasing prevalence of anxiety in modern society and the resultant compulsive behaviors people develop as coping mechanisms. From mild compulsions such as repeatedly checking for messages to extreme OCD-driven behaviors, you'll explore the interplay between addiction, compulsive behavior, and impulsive behavior in individuals. Through this exploration, you'll learn how people cope with anxiety, the neuroscience behind compulsions, and how these behaviors and treatments have evolved over the years.
The Reality of Compulsions. The prevalence of anxiety in the U.S. leads people to adopt mechanisms for coping such as compulsions. These behaviors create the illusion of control and ease anxiety enough to allow daily functioning. Compulsions stem from a need so desperate that it feels like a vessel filling with steam. Mild compulsions like checking phones and perfecting towel hanging can escalate anxiety levels when not performed and are prevalent. Extreme compulsions come from the same source as other coping mechanisms and require help and compassion. Meanwhile, some people find compulsions adaptive and useful for efficiency and happiness. Redefining Addiction, Compulsion, and Impulsivity. The American Psychiatric Association's Diagnostic and Statistical Manual, DSM, has revised definitions of addiction over the years. Addiction is characterized by pleasure, tolerance, and withdrawal. Meanwhile, compulsive behavior doesn't bring pleasure, but not doing it causes anxiety. Impulsive behavior, on the other hand, is driven by immediate gratification. Understanding these distinct qualities can help identify and treat behavioral issues effectively. Kleptomania is an example of impulse control problem, while gambling meets the criteria for a behavioral addiction. The DSM revisions address the commonality of brain circuitry associated with substance abuse, chocolate craving, and compulsive behavior. Understanding OCD. OCD is a mental disorder that affects individuals from mild to extreme levels. For people with OCD, performing a compulsion-driven behavior reduces intense distress and anxiety. The compulsion feels external, and due to this, suppressing the behavior calls on them to perform a new form of compulsive behavior. OCD happens in the frontal cortex and striatum, the worry circuitry of the brain, where individuals cling to compulsions as a lifeline. People with OCD often have just right compulsions that bring temporary relief from anxiety. They perceive the thought of not performing a compulsion-driven behavior as the cause of a horrible situation. It is challenging to diagnose since it has atypical symptoms that clinical psychologists don't recognize. Understanding conscientiousness. Conscientiousness is a crucial aspect of one's personality, reflecting an individual's ability to follow rules, be orderly and opinionated while also being achievement-oriented. However, when conscientiousness is taken to the extreme, it can lead to obsessive-compulsive personality disorder, OCPD. Unlike OCD, people with OCPD carry out activities in a way they believe is sensible and easy to rationalize, often leading to rigid standards being applied to themselves or those around them. Anxiety is the root cause for this condition, making the world seem a safer place when activities are performed in a particular way. New hope for OCD. OCD patients can find relief through exposure and response prevention, ERP, therapy and mindfulness-based cognitive therapy. ERP therapy challenges the patient to resist compulsive behavior during anxiety-triggering situations, reconditioning the brain to wait instead of giving in. A 16-week ERP program that is difficult for 50% of patients can result in recovery for 60 to 80% of those who complete it. Meanwhile, mindfulness-based cognitive therapy teaches patients to observe their thoughts objectively and disregard obsessive, deceptive thoughts for optimal brain function. This therapy proves effective in treating OCD in 55% of cases, providing new hope for sufferers. The addictive psychology of video games. Game designers use varying levels of difficulty and rewards to keep players hooked on video games, while exploiting human psychological tendencies for variable and intermittent reinforcement. This compulsive behavior can also manifest in individuals who are overwhelmed by the existence of suffering and feel a compelling need to help others. Slot machines capitalize on these predispositions, with players continuously trying their luck with varying probabilities of winning rewards. Internet addiction disorder, myth or reality? In 1995, Dr. Ivan Goldberg posted an online ad for a support group for Internet addiction disorder, IAD, which gained momentum despite not being designated as a mental disorder in the 2013 DSM. Excessive web use, though compulsive, is not pathological. Designers of applications exploit the need to feel connected and capitalize on innate human tendencies to tempt people to play. The intermittent or variable reward system works here, too, causing people to continually check their social media in hopes of finding something worthwhile. With digital devices becoming the primary way to connect and communicate, people become anxious about being left out of the loop, succumbing to fear of missing out, FOMO. The psychology behind hoarding. Bonnie had accumulated hundreds of boxes and bags of items in her home, leading to a hoarding disorder. Randy Frost's 2-decade study reveals that most hoarders exhibit the first symptoms during childhood and purchase or save duplicate items to avoid being unprepared. Hoarders imbue objects with emotion and see potential even if they don't use them. Compulsive shoppers also exhibit similar symptoms to hoarders, treating purchase as a temporary escape from distress. Therapists treat shoppers by helping them identify emotional triggers that cause compulsive shopping, encouraging them to ask 6 questions before making a purchase. Anxiety and the drive to compulsion. Anxiety can drive people towards compulsions, including extreme altruism, creative art, and even hypergraphia. Altruistic people have larger amygdalae, allowing them to be more empathetic and ultimately feel less distress. Compulsions, like recording every thought on paper, have been linked to hypergraphia and epilepsy by neurologists Stephen Waxman and Norman Geschwind. Brain imaging cannot provide a psychiatric diagnosis, but the relief of anxiety is a commonality among all compulsions.
Sharon Begley's Can't Just Stop. An investigation of compulsions takes us on a fascinating journey through the realms of human anxiety and the compulsive behaviors adopted to alleviate it. The book illustrates how addiction, compulsive behavior, and impulsive behavior intertwine, giving us a nuanced understanding of the complex mechanisms behind these conditions. Treatment options are also explored, from medications prescribed, to exposure and response prevention therapy, and mindfulness-based cognitive therapy. Cases like compulsive hoarding, buying, and hypergraphia reveal how these behaviors impact everyday lives. By the end of this summary, you'll gain valuable insights into the driving forces behind compulsions and how the desire to reduce anxiety lies at the heart of these behaviors.